First of all, when you meet a patient, you've got the inquiry side of it. So the information that I've learned over the years, the experience, as you could call it, you kind of get a gist of what you think may be going on as you talk to somebody. And then the skill is in actually trying to extract that information from the patient using clever sort of ways of questioning. So by the time you actually go to the examination, you've got a rough idea of what you're going to be testing for. And then there's the testing side of it. You know, as I said, you've got different body types, different personality types, the way they talk about their pain. So you look at them, you observe, and you think that, let's say somebody's in their 40s, you think, right, they've been walking on their feet for 40 years, they've had different accidents that came up in the case history, all these different things are wrapped up into this body, and it's up to you to try and find out what's going on, to feel through, use your hands as diagnostic tools. That's what I love about it. So you run through the examination, you may sort of feel into, segmentally, into the cervical spine, into the neck, into the thoracic spine. You see how it all fits together as a 3D structure. You think about gravitational forces. Often problems are what we call ascending, so they come from the feet up. So you can look at the feet, if there's dropped arches or little knees that are turned in, or knock knees or bow legs or anything like that, that goes into the pelvis. And then if it's a short on one side, then there's going to be more compression. If there's more compression there, it's going to be tight muscles. So you start to learn this sort of, I suppose it's pattern recognition. And once you have a rough idea of what's going on, you create a diagnosis, a working diagnosis, and that could be kind of medical, it could be osteopathic, but that will then inform your treatment plan and your management plan. So that's the osteopathic side of it, but also we do orthopedic testing, we do neurological testing, we do medical testing where we'll be taking blood pressure, pulse rate, listening to lungs. And in some cases, as has been said before, osteopathy is not a cure-all. It's not there to sort of treat everybody, because some people may be best off with another healthcare practitioner. It may be that because of their feet, you refer them to a podiatrist. Or if there's something a little bit more concerning where you feel that there's some further investigation needed, you'd be wise to write a letter and actually refer them back to their GP. Maybe get that information if it's a scan or a blood test, and then that will inform your management plan. It may be then you see the patient back and you could be more assured with what you're working with. What I love about this job is the variety. And no day is the same, and that's great, because I deliberately haven't specialised. I know some people specialise. I deliberately haven't specialised in sort of 25 years because I would like to keep the breadth and scope of patients I see very broad. But thinking about an average day, well, you know, I do treat babies, but I don't see an awful lot of babies, and sometimes there may be issues with sort of the way they've been born, and their sort of heads are a little bit tilted, and they're finding that there's a slight bias. So some very, very gentle, we don't do anything, you know, with babies it's all very subtle, very gentle, just working with the tissues. And that's a great thing about osteopathy. You're becoming familiar with what you can actually do, how compliant muscles are, how, you know, joints are. And that's not just with babies, but especially as you get older, you get to know the quality of joints, you know, degenerative joints, what it feels like, joints that are being compressed, that become very restricted. And that's the sort of thing you may look to work on. So I've treated, for instance, today I saw people with degenerative cervical spines. They're getting sort of neck pain, general pain around there, because of age-related conditions, and because of the work that they're doing. I've seen an awful lot of teenagers lately, so with tendinopathies, problems because they're playing too much sport. Again, maybe neck pain. I'm seeing an awful lot of people because they're sitting at desks incorrectly and posture isn't great. And as far as treatment's concerned, you know, it says we do massage on the sort of publications and everything, but working with muscles is very different. You know, there's tight, there's fibrotic muscles, there's tense muscles, and muscles have kind of different statuses or different conditions that they're in, and treatments will be different. You don't just massage it, you can do gentle inhibition and trigger point. Some need stretching, some need what are called muscle energy techniques, MET techniques, where you actually activate the muscle to take advantage of the relaxation. And if joints are stiff, we mobilise them. We call it mobilisation or articulation, where joints are bathed in synovial fluid. So you're looking at you can't oil a joint, so you look to sort of mobilise it gently, and you get the soft tissue around that to sort of relax off. Looking to restore improvement and restore mobility to areas so people can function better. So people tend to come to osteopaths for hands-on treatment, which is fine because that is what we do and what we're good at. However, we've got another role which is kind of interconnected with that, which is health promotion. promoting public health initiatives, trying to get people to assist them with directions how to stop smoking maybe, losing weight, and definitely increasing physical activity. So trying to promote their health as well as what we can do. As an allied health professional, and there's 14 of them, we really should be seen as working with these other, collaborating with these other healthcare professions. And osteopathy is not a distinct entity. Yes, we've got our own identity and we know what we're good at, but we've got to work, we've got to recognise the scope of osteopathy and when we need to refer. And also, you know, we do a lot of not only health promotion, but we're on the physical activity side of things. We recommend, we prescribe exercises. It's not just what we do with our hands. So we will be giving patients a program of exercises to do, and we can monitor they're doing them correctly. And I think that tends to be seen as another field like physiotherapy, but it is something we do. And there's a lot of apps, there's a lot of sort of online things that osteopaths are looking to utilise now.